All right, welcome to another episode of Limitless Live. I'm excited to have my friend Josh Crumley with HealthMarkets Insurance with us today. So, Josh, I'm just going to start by telling people a little bit about what I know about you, and I'll let you
Okay.
fill in the gaps. How about that?
Sounds good.
So I met Josh 6 years ago now, believe it or not, through a networking group that we both joined at the time. And it's funny too because Josh and I have had a pretty cool relationship because the way that we set up Limitless is that we have a pretty unique relationship with health insurance, and that we don't exactly play nice together in some cases, and that's okay. And yet, Josh and I developed a really good relationship early on because Josh understands, in my mind, exactly what the purpose of health insurance should be, right?
Yeah.
Which is, from my perspective, and I'm going to let Josh fill this in, but from my perspective, the goal of health insurance is to keep you out of crushing medical debt, right? And
absolutely.
so when Josh positions things that way, he never once have I heard him try to sell health insurance as some all-encompassing solution to help people move and feel better and live longer and all that kind of stuff. That's never what health insurance was intended to be. And when Josh shared that perspective, I knew we would really click and hit it off. And then since then, we've certainly developed a friendship and, done some things outside of business. And Josh has then been a client of Limitless. So all that's been really cool. So I'm excited to have Josh on today. So Josh, I'm just going to start by asking you a little bit of like the path to selling health insurance.
Yeah.
So tell me more about the story of how you got here.
Yeah, so definitely wasn't in my life plans. My dad was actually in insurance for over 30 years, but he did the home and auto side. And so
Okay.
I think, early on I realized like, man, definitely sounds like boring stuff to me. Not anything I want to be interested in as a career, but I've had a few different career jobs. I think, I was in logistics for quite a while, and I worked for a third-party logistics company before I met my wife, and I got to travel to a lot of cool places and do a lot of cool things. And but the traveling part, had to, in order to have a marriage that works and things like that, you have to cut that off. And so I ended up doing logistics for an auto supplier, and I was sitting in a cubicle. So, I'm more of an outside cat. And now I was inside and realized, after a certain period of time, hey, this doesn't make me happy at all. And so, my cousin actually had been, in insurance, doing health insurance for, at that time, 12 years. And, he's like, hey, why don't you just come give it a try? You like talking to people, you like being out, this might be a really good decision for you. And I was like, well, man, dude, I don't know anything about health insurance. I've never used it, right? I'm healthy. I don't know. I have it, but, and he's like, well, we'll learn the product and, just come try it. So made a leap of faith, started my business, making $0 a year. I had a wife, she's a school teacher. Laura kept us afloat for a little bit. My son at the time was 6 months old, and, really had, man, just by God's grace, man, it just kind of took off. Had that work ethic, and I found really quickly I had no idea what I was doing when I was selling health insurance. I was literally just reading off the summary of benefits, telling people like, hey, here's your copay, this and that. And then it clicked for me. And so once it clicked for me, I was able to talk to people about it and realize really quickly that, man, there's so much confusion. People don't understand health insurance at all. It's a very tough product to understand. And when I saw the light bulb come on for them, I was like, all right, now I know why I'm here, right? I'm providing value. Regardless of what the product is, I'm providing value, whereas I didn't feel like I was providing any value to anybody. I was just going into a job, checking in, checking out every day.
Yep.
So
Yeah.
here I am,
There you go.
10 years later.
That's right. So now that you've been doing this for a decade, basically, what are some like cool stories or situations that you can kind of recall in terms of some situations that you maybe had with clients or things like that, where they've come in either not understanding health insurance, not being able to get health insurance through their employer, having a bad experience with a health insurance broker in the past? Like, do you have any specific like stories or instances where you look back over this 10 years and you're like, man, I'm really, really proud of how this situation turned out, or something like that?
Yeah, I don't know if there's a specific situation. There's been so many, right? We've built, I think the relationships that we've built have been very cool. I think for me, the most rewarding part is like when we meet somebody and we see every aspect of their life over 10 years, right? We meet them as a single individual, right? Then they meet their girlfriend. That girlfriend becomes a wife. They have
Mhm.
child one, child two, and it's like, wow, I've been a part of that, through the births and all these things because we have these conversations. And the thing is with people that are newly pregnant and stuff like that, finding the right plan for them for the birth
Yep.
is a huge deal. We're doing cost analysis. We're trying to figure out what's gonna be the most cost effective for them. And I think that's the coolest part. We've done that year over year and letting them know like, hey, you're gonna have a lot of things come your way, but like this is the one part you're not gonna have to worry about. And then making sure we're there for them to answer the questions and be a good teammate.
Yeah,
So
perfect. So for you, one of the things I talked about in my opening was that what I appreciate for you is that how you frame health insurance. So without me speaking for you, why don't you just tell me a little bit about what you say to the person that either doesn't understand it at all or maybe is coming from that situation of like, man, I just came from a plan where I was paying $2,000 a month and it was a total waste of time and money and blah blah blah. Like, why do I even need health insurance to begin with? Like, how do you have that conversation
Yeah,
with people?
I always tell people, and I think this is where you and I get along really well. Is health insurance doesn't have to dictate how you take care of yourself, right? You guys don't take health insurance, but I come here, right? And the reason I do come here is the fact that I know that anytime I deal with any of your PTs, Kaipo, Sam, any of those guys, even yourself, I've worked with,
Yep.
is that when you bring me in. I know you're not here to continue to bring me here over and over, right? You're going to take care of my health. You're going to get me out the door, and you're going to try to save me money.
That's right.
But I know I'm not going to have to come back for the same thing, hopefully,
Right.
and I
Right.
haven't. So,
Right.
but I go to a chiropractor. I have an acupuncturist. Like I look outside to find the best fit for me. However, I always tell people, look, there's when it comes to hospitalization, right? Something that you never saw coming, a diagnosis like cancer or a car accident or something like that. You need a surgery. You're working with Jay and you tear your arm. You have to get surgery,
Right.
right? It has its place.
Mhm.
That's when the bills start rolling in, and until we can find hospitals that will give us huge discounts on those services,
Mhm.
health insurance is going to have its place. And we try to. There's some people that have to have higher level plans, and they have to spend a lot of money because they have a lot of high end medications. Again, that's a whole nother thing, the pharmaceutical industry,
That's right.
right?
That's right.
um but when we attack it, we just always want to make sure that people are educated, they understand why they have to have it. I have homeowners insurance and car insurance, and I pay it every single month. And I don't drive recklessly. I don't put my house in situations where it's going to burn down, but you just never know. Insurance is something there, but you have to make sure whatever you put them in, it's there to deliver when they need it the most.
That's right. That's exactly right. Um, so having said all that, then from a perspective of, hey, this is what I do for a living, but hey, I then still it's my responsibility to go find who the best provider is for me. One of the things I've really appreciated about you and your group and what I know about you guys is that I think one of the most intimidating things about health insurance is that when it's time to use it, it's like, what do I do? I just have this card right here and there's some numbers on there and then there's a 1-800 number on the back. And so some of the coolest stories that I've heard you tell or some of your team members tell is that somebody's literally on their way to the emergency room or, taking their wife on the way to the hospital to give birth to a baby and they're not calling that 1-800 number on the back of their card. They're calling you guys.
Yep.
And you guys are actually stepping in and helping facilitate that process, advocating for them, telling them exactly what their next steps are and stuff like that. So I know, at least in my opinion, that's not a standard thing for a health insurance agent. I feel like I've heard plenty of situations where it's like, "Hey, I sold you the policy. Call the number on the back of the card if you have questions." I'm
Yeah.
not, I'm not the person that pays the bills. I'm just the person that sells you the policy. So why is it that you guys decided to take that next step to say, "Hey, here's my number. If you have any questions, or if you're ever at the hospital and you don't know what to do, like call me."
Yeah. So I'm big, because I don't think that's how I would want it, right?
Right.
I'm more relationship built more so than transactional built, right? Anybody can, I can go on and sign up. There's a lot of capable people that can go online and potentially sign up for their own health insurance plan. Um, you know, what they're going to get, and if it's the right plan, they don't know, right? That's kind of where we come in. But we want to make sure that our clients, have somebody that's an advocate for them. I always tell them, hey, we're teammates, right? Like I don't work for the insurance company. You and I are teammates, but I can only be a good teammate if you keep me in the loop of what's going on in your life, right? And we want to try to stop that frustration of dealing directly with an insurance company on the front end, because we have contacts within that company that you don't have, right?
Right.
You're calling an 800 number, you're talking to somebody that might have just started, and gives you an answer, might not be correct. Customer service these days, it's a 50-50 shot whether you're getting the right information or not. So we like to say, hey, call us. My assistant Lissa, you've met her,
Mm-hmm.
and you know, we've got the answers you need. And if we can't find it, we're going to research it. You continue to live your life. We'll handle it over here. We'll get back to you. Just give us a few minutes, and we go from there. And people love that. And I think that's how we've built our business, is being better at customer service, than others. Being there when they need us the most.
That's right.
Yeah.
And there's something similar to what we do on our side, which is, um, I wish I had a solution that was all things to all people and could solve all problems, but I don't. So inevitably, along the way, there's times where we have to involve another provider in the process, whether that's a physician, a surgeon, a whoever. And so there are times where somebody goes, "Okay, yeah, no problem. I'll just call the number on the website or whatever." I'm like, "No, actually, let us call for you, because here's the deal. We have, the cell phone numbers of the people that are actually the referral coordinators or the provider themselves or whatever, and instead, you're going to leave a voicemail on a line that gets checked maybe once a day, and then they may or may not get back to you, and you guys are going to play phone tag for however many days,
Yep.
and then they're going to tell you their next available appointment is 6 weeks out from now, because on their triage scale, you kind of fall far down on the list on who they need to get in right now. Whereas when they get a call from us and we say, "Hey, we've been working with this person, we know exactly what's going on, and here's what the next step is. When can you see them?" And they're like, "Yeah, we got a spot tomorrow afternoon. You want me to call them and set it up?" Yes. Right. Like that makes that whole process so much easier. And so it's really, yes, it's a courtesy to our clients, but it's also one of those, like, I promise you, you're going to have a better outcome if you just let us take this one extra step for you and just
Absolutely.
send an email or make a phone call that's going to take us all of 90 seconds, but it's going to save you days or weeks of time.
The questions to ask. That's the biggest thing. They
Right.
don't, right? And that's kind of what we tell them. Like, you don't know what you don't know. I know that you have a problem, you're calling in, but if you don't ask the right questions, you're not going to get the right answers,
That's right.
right?
That's
So,
exactly right. All right. So now you've taken on this role of not just a salesperson, but an advisor, right?
hmm
Somebody who, like, can actually walk people through, hey, okay, something's happened. Here's what you do, but let's take it back even a step of, there's people, I would say most of people in a corporate America job, they have a group insurance plan that's offered through their employer, right?
yeah,
So I'm sure something that you hear a lot is, hey, come on open enrollment time, like, they probably don't even look around because they're probably just like, hey, this is what the company policy is for the year, and so this is what I'm going to sign up for. And at
yeah.
least I can speak from personal experience where, my wife works for a larger company that does offer health benefits, which is great, and I'm really grateful that they offer that,
hmm
right? But their benefits are set up to where, for her, it's extremely affordable and economical for her to be covered under her company's plan.
Yep.
But to add any other member of our family to that plan is just ridiculous,
Yep.
right? It's astronomical.
Yeah.
And so, again, this is your industry, so I know you're familiar with situations like this, but, what maybe is, like, some good advice or a message to somebody that, is in that corporate America job, and they don't do their research ever. It's just like, I mean, these are the benefits that I get as part of being in the job, so I'm just going to check the box and say
Yeah.
yes again for another year.
Yeah, I know it's been interesting to watch it over the last 10 years, how health insurance, not only just here in the individual market that I deal with, but also watching it change within corporate America, right? Like, when we were growing up and we were on our parents, it was much more affordable to have a family on healthcare. And so now, like, you're starting to see more of, businesses are, because this is all they can afford to do, which is better than nothing, but they take care of the employee, but everybody else is, it's kind of a train wreck when it comes to cost. And so, we have a lot of those folks that we bring in, and there's certain percentages that if you're paying X amount towards your health insurance, we can find you a plan on our end and do something. But In a lot of cases, we do have clients, old clients that were clients of ours, and then they have a job, and we always tell them like, hey, look, when you have these opportunities every year, and they propose plans to you, you need to make sure that you're educated on what you're signing up for, right? So we encourage them to give us a call. It doesn't take me, or send me an email with what they send you, or what your choices are. I know you, and I know the needs that you have. I can shoot you back and break everything down for you, and tell you like, hey, this plan is excludes this. You need to know that, or hey, this benefit over here is great. This might be something you want to think of, instead of, like you said, just checking a box, and then when you need it, it's like, oh crap, like
Mm-hmm.
what is this?
Mm-hmm.
Because corporate America doesn't. A lot of it's driven by HR, right? And those people aren't benefits coordinators.
Mm-hmm.
They're there, and they just give you the options, and they can answer some basic questions, but to really get in and find out what the best plan for you, they leave that up to you,
Yeah.
right? And so we think that providing that benefit at no cost to folks, really generates some goodwill, and we get a lot of referrals off just it might not help us in the front end,
Mm-hmm.
right off the bat, but in the back end, man, and we really start building a good clientele of being those folks.
So what I just heard is it would be wise for pretty much anybody that doesn't feel like they are very knowledgeable about their plan and intentionally selected this plan. It's more of like, hey, here's what the company offered. It would be wise of them to at least reach out to you to
Yeah,
say, hey, here we are. We're in this, open enrollment window of 30 days or however long it lasts. Like,
yeah.
do you mind just reviewing this for me and help me identify like what are kind of the strengths and weaknesses of this plan so I can know whether it's the right fit for me and my family?
Absolutely. Yep. And we've got some other products. We sell a lot of supplemental products, accident plans, cancer plans, critical illness, all those things that where if you're choosing, let's say, a really high deductible plan, and your company doesn't offer you disability or something like that, well, what happens if you get cancer and you can't work, right? Do the paychecks cut off? Like, what is this going to look like financially for you? Do you need help, protecting your income? Like, we have a spot to where at least we can talk and maybe fill in some of those gaps for people as well. But yeah, we love just kind of taking a look and educating people. I think that's a big part of the job that we do is, it's fun to sell. That's how I provide for my family, but it's really, really rewarding to be able to provide a benefit to people, and be able to help them through that tough process.
Yeah. So healthcare in general is just this ever changing, hard to predict kind of thing. So I want to ask you kind of a two-pronged question. One, I would just say like, what do you, as somebody who's just in the industry, what do you think is going to change in the near future? And then maybe the second side of that question is just like, what do you hope is going to change over the next, say, 4 or 5 years?
Yeah, that's a really great question. I was talking to a guy in the lobby earlier that you know it is ever changing, and it's tough for us. Like, we have to always be educated on what's going on so that we can educate our clients and kind of be ahead of it so that there's no surprises. But healthcare, there's no surprise there. It's a bit of a train wreck, right? Anytime you have the government involved in something, it doesn't end up how it should be. Those
Yeah.
folks, they don't live like us. They don't use the health insurance we use, right? Like, so why are they making the decisions? And there's a couple things that we've got to fix. We got to fix, how much the increases in pricing are happening, right? And that starts at the top. It starts with the hospital systems, and it kind of comes downhill because that's how it is now. You got hospital systems, they'll say, hey, here's $45 for a box of tissues,
Right.
right? And the insurance company's like, all right, well, we can only afford to pay this much. And then it just filters down to us.
Mm-hmm.
So we've got to figure out where do we regulate pricing from the top down, and then help us. But we gotta have more choices in plans, right? We've got to
Mm-hmm.
have, I think, you have people that with pre-existing conditions that need certain plans, right?
Right.
And we have those. But what if we had really, really good plans that may be for healthy people that didn't have a pre-existing, um, you know, benefit on it, because that drives up cost, right? Maybe something that allows them, more freedom of choice, more PPOs, in and out of network type benefits. Um, but it's really hard to tell. They don't they don't talk to us.
Right.
They don't ask our opinion. They
That's
make
right.
decisions, and then we have to adapt to them. But it would be nice to have them actually, people in Washington reach out and say, hey, what do you guys think?
I know. Yeah.
But
Yeah,
Yeah.
I love those thoughts. I've got a few too. The first one I always think of is HSAs. I wish they were easier to get. You know, right now you have to have a high deductible plan to get one. And then the other thing is there's caps as far as how much you can put in them every year. And I realize
Mhm.
the government wants their money, right? They don't want to
Yeah.
let you put too much into a tax advantaged account because they want to make sure they're getting to tax that money.
Yeah.
But at the same time, the government's already having to subsidize healthcare so much as it is, right?
Yep.
You can spend less money and maybe get a little less, or right now what they're getting is they're getting more in tax revenue, but they're spending a whole lot more too, right? And it would allow, when you talked about freedom of choice a little bit, like it would allow people a lot more freedom of choice to say, hey, if I was spending less on my premium and taking that money and putting it into an HSA instead,
Yep.
then I'm still covered from the catastrophic side of things. But doggone, I have this $10,000 deductible that I have to meet before I can even use this
Yeah.
plan anyway. Why can't I let that money be tax free as it goes into an account, right? Like
I know. I
that
know.
that seems like a simple thing. And then the one that gets me as a healthcare business owner, I'm not sure if you're familiar with this topic, but this idea of site neutral payments. So it's this idea that like if a service occurs within a hospital system, they can bill a certain amount for that, which
Mhm.
most plans actually have a higher allowable amount for something that happens at a hospital versus at a freestanding clinic
Yeah.
that's unaffiliated somewhere else. But all that does is, like you said, continue to drive up costs and drive up price because you can get the same service here if we were participating with an insurance plan and then over at the hospital system with their outpatient therapy, and they could charge 2 or 3 times what the allowable amount would be for what we could do here. And it's only because that they're non-neutral site payments. In other words, if it's at the hospital, even if it's not somebody that's hospitalized, they're not an inpatient.
Yeah.
They're just literally going into the hospital facility. And just because their 2 feet are planted in this facility, automatically we're able to bill 2 or 3 times what that amount is. And again, it's just one of those like, we know why that's that way. It's designed to crush the smaller
Yeah.
guys, right?
It is.
Like,
It is.
but it's silly because all it's doing is you're still passing that cost on to the consumer, because if the insurance is paying more for that service, the insurance isn't paying that money out of money they don't have. They're paying that out of the premiums they've
Yeah.
collected, right? And if they're spending more than what they're collecting out of premiums, what happens next year? Premiums have to go up, right? So I feel like it's this endless loop of if we're going to continue to allow, and I guess one other thing I'll throw along with that is just price transparency, right? Like how many times do you ever walk in to any doctor's appointment, go in for a surgical procedure, whatever, and no one can ever tell you what it's going to cost,
Yeah.
right?
I know. I agree because people ask me, well, how much is it going to cost? Psh, I don't know. Here's your.
Yeah.
I can't tell you that. Like I have no idea. There's one plan with Blue Cross that they have. It's their Bronze 6. It's the most price transparent plan that I've ever seen. Everything has a copay,
Okay.
right? When everything has a copay, right?
Right.
Now I can tell you. If there was more plans built like that, then
Right.
that would be nice. But again, you go back to the HSA, Jordan, where in theory, you hear these people like, "Oh, we'll take this and we're gonna put everything in an HSA." Well, what is $8,000 for my family going to do if we end up in the hospital?
Right.
Nothing.
You can't
You
put
know?
everything in there. You're right. You have to still have that safety net.
Yeah,
And that's
exactly. But I've got to, or you have to take away the limited amount and
Right.
allow me to put as much money as I need in there,
That's right. That's
To
right.
to cover that stuff. So, yeah, there's a bunch of moving parts, man.
Yeah, at the end of the day, there's so many people, stakeholders who have their hands in the pot also. So it's a very difficult thing to accomplish anything big, because at the end of the day, what ends up happening, it seems like every time, is that there's some new legislation or new thing that comes down, but at the end of the day, the person that's at the bottom down here is the person that still ends up paying more
Yeah.
at the end of the day, right? And that's unfortunately what needs to change. All right, so last question that I have for you then is just, you're obviously growing a team. So I wanted to hear more from the standpoint of how that's going and what your goals are over the next few years in terms of continuing to have not just Josh Crumley with HealthMarkets, but having the Josh Crumley team. What's that experience been like, and what are some of your goals for growing your team?
Yeah. So probably about 3 or 4 years ago, I just kind of stepped into, hey, I really like doing what I'm doing. But I really was looking for that next thing of what's going to be most rewarding, right? And having agents come in and have a place where they feel welcomed, and where they can help other people as well. And we've been able to develop that. We brought in a lot of great agents over the last 3 or 4 years that have the same heart, right? They just want to come in. They aren't really big on necessarily, health insurance. They're not gun ho on that, but they're gun ho of like providing value and helping people,
Yep.
right? and they hustle. They get out, they network, they like to meet with people. That's the things that I like to do. And so what we do is say, hey, we're not about the transaction, we're about the relationship. So if you're not going to be able to build relationships and be available, and this is not a 9 to 5 job, right? If you can't do all that, that's probably not a great place. And so we've been able to build a really good team, and every time we get a really good agent, they seem to refer somebody else. So,
Nice.
the thing is to kind of have this area, have the upstate. Really pinned down to where when they think health insurance, they think of the agents at Health Markets,
Hmm.
right? We want to be that go to, and I think we've done a good job at that. Just like within Limitless, man, you've built a really solid team of like-minded people that really have the same goal. And you've met Eric and Lissa. They're
Hmm.
direct team members with me, but all the other agents we have on our team, everybody you've come across, and everybody that talks to us are like, hey, you have a really good team of agents, and we do. And my job is to help them build their own business, right? Show them the what they can do and how great it can be, but also kind of help them through all the mistakes that I made, right? And so
Yep.
hopefully we continue to build and build and build. And if you do know of anybody that wants to get into the industry and loves helping people, we'd love to be that first conversation they have.
Cool. So you're still in the actively looking for people who
Actively looking, man,
looking for new
always.
opportunities.
Yep,
Okay. Very cool.
absolutely.
All right. Well, Josh, this has been fun. Obviously, I've known you for a long time. It's the first time we've actually sat down and have a recorded
Yeah.
conversation. So we'll have to do it again sometime. But we'll kind of call it for now. Last thing I like to do is just let people know if they want to learn more or be able to connect with you. What's the best way to do that?
Yeah, they can either call the office 864-999-1384, or they can find us online at just Google Health Markets Josh Crumley, and reach out to us that way, and we'll get you connected with an agent in our office or myself, and answer any questions you might have.
Awesome. Thanks for being with us, Josh.
I
Appreciate
appreciate
it.
it, Jordan. Thank you.